जी जी आ रही है।
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين وسلام على المرسلين والحمد لله رب العالمين والحمد لله رب العالمين صدق الله العظيم.
Jazakallah.
Jazakallah khair. Now, I would like to express our sincere gratitude to our all esteemed speakers and our all audience for joining us today. Before we begin, I would like to extend my heartfelt greetings to the glorious Dr. Muhammad Yunus Rana, our patron Professor Dr. Anila Zamir Durrani, and our distinguished guest Dr. Ejaz Rashid Taha. We warmly welcome you all here today. So now it is my immense privilege to introduce our distinguished guest, Dr. Ejaz Rashid Taha, the Noble General of the Royal Imperial Command of McGill, Chief Secretary General and CEO of East Windsor Animal Hospital, New Jersey, USA. With over 25 years of clinical and surgical experience, Dr. Rashid is a globally respected figure in veterinary medicine. He holds a postgraduate degree in clinical studies from the University of Missouri Colombia, and is known for uh, pioneering advanced treatments like stem cell therapy. Dr. Rashid has co-developed an anti-cancer vaccine in partnership with German scientists and led the first successful captive breeding of the Royal Bengal tiger in Asia. His tireless efforts to mentor young veterinarians and support global collaborations in animal healthcare are truly inspirational. Sir, we are honored to have you with us today and humbly invite you to share your valuable words with us.
Assalamu alaikum to everyone. Please accept my regard to all professors, students, teachers, and my colleagues, my friends all over the world who joined this conference. And I would like to special thank Madam Professor Anila Durrani. I think she's the resources person for this evidence-based medicine. I think we start maybe this conference maybe 6 or 7 years ago, and I would like to say that a lot of changing happening in Pakistan, especially in the Lahore, the practice veterinarian. A lot of veterinarian they text me case study, they text me the blood work, X-ray, all these things. Okay, before they say, sir, the people they don't want to any X-ray, any diagnostic, they don't have money, and also clinic does not have any blood work machine, X-ray, anything. No, I see the people are buying the all the diagnostic tool. So I think this all credit go to the major credit go to the Madam Professor Anila Durrani and all her is Vet Crescent Society and all Mago Society and all other who arrange this evidence-based medicine. And other thing, I think the our respected guest, Professor Dr. Rana Yunus Saab, is not here. Uh, we definitely miss him. And one thing is very common. that me and Professor Rana Saab, we belong to same district, and we are proud of our district because due to his achievement in veterinary medicine is unbelievable. Rana Saab, may Allah, God, gave him more success in veterinary medicine, and I hope he will make US as a modern university in Pakistan. I would like to start. I would also thank my very respectful teacher, my uncle, very family relationship, Professor Akram Munir Saab, who are joining our conference also. And he has a lot of contribution in veterinary medicine, especially in poultry field. And we are very blessed. We have all the professors, teachers, students attending this conference. I would like to start the outline of this lecture. Why I'm forcing evidence-based medicine? Because we are doing this seminar last maybe 6-7 years. And inshallah, our next conference, we will discuss some of the more complicated, not the evidence-based medicine. I'm thinking about, we want to discuss in next conference, hemoabdominal or other life-threatening condition, which is most important in the field or clinical aspect to handle this life-threatening case in practical life. Inshallah, we will discuss in the next conference because we discussed already a lot of lecture on evidence-based medicine. I hope that's enough, but if we need, we can discuss again in future also as well. Simple as evidence-based medicine, why is very important? Evidence-based medicine is important because when you have evidence, what are you treating your patient? Believe me, you have more confidence in your body. Your body language will be changed when you find the diagnosis of the patient, when you go in the room, speak with the client, and you have more confidence, like what are you treating, what is my diagnosis, and what is the prognosis, and what is want to go, which way you want to go, what is the option, you can discuss with the confidence. But if you don't have any evidence, you are treating just like blind, you don't know about what you're doing. So evidence-based medicine is very important in veterinary medicines. And I would like to study some of the real case. Our objective is that to show the Pakistani veterinarian and students how we diagnose the real case in USA with the latest diagnostic technology. If I have a time, I can discuss some of the game-changing new product in veterinary medicine in USA within a couple of minutes. The evidence-based medicine, the most important ingredient in evidence-based medicine is that the physician eye vision and the brain, and how sharp brain to diagnose the disease. That's the most important thing. If you don't have a sharp brain or you don't have very good knowledge, you cannot diagnose the disease properly. Maybe you will do like 100 tests and after that you diagnose the disease, but that's not way. That's called like a malpractice. You have to go like to the point and diagnose the disease with a limited test so the animal and the patient and the owner does not feel bad that we are doing like a unnecessary test. Okay, so that's why we call the brain of the physician, and the knowledge is very important in the evidence-based medicine. I would like to give some of the example, just like this is one case. If you look this one, this has the corneal ulcer in this patient. But if you don't do the staining, corneal staining, you will miss this diagnosis. And if you put like any steroid medicine, that will be contraindicated. The ulcer will not heal properly, and you will maybe get a problem if the complaint go to the board. You don't have any defense on this case. So make sure a small thing maybe make a problem, or small thing make you happy with the diagnosis also. So we would like to start the first case. Before I start the first case, I also want to say one of my colleague. We studied together, University of Missouri. He is from India, Dr. Ajay Madan. I believe he will be in the conference or maybe another conference. Next time, he has very good knowledge. Whenever I have a very difficult case, to be very honest, I always discuss with Dr. Madan. He has very grip on knowledge, very practical knowledge. We study together. He's a very good veterinarian. Inshallah, I will bring next time also in the conference. The evidence-based medicine. This time, I was sick. I like to prepare some new cases, but I cannot due to the short of time and my health is not very good. I get like a very bad strep throat. So I just want to make us, I have a lot of new students, maybe they can get the benefit. Why I select this case? This case I select to show you that step-by-step diagnose, step-by-step how we diagnose in USA. Very simple case, but very interesting case. This is like an 8-year-old male domestic short-hair cat is presented in our hospital. He has a history of the previously we diagnosed already diabetes, is on insulin. The owner say is drinking excessively. That's very normal, but everything is normal. But she gaining the weight. The abdominal is distended. Only one thing the owner noticed. The owner has a concern. Why my cat gaining the weight? What is the reason? Is there anything wrong? So this small concern, when they bring to our hospital, let me show you their conversation also. So you know that. How about the eating and drinking?
Eating and drinking is fine. Everything is good. He's happy. The tail's wagging. He's purring. He's very happy. Just the gaining of the weight.
Okay, there's only one sign you see, gaining of weight.
Correct.
There's anything wrong.
Nothing else is wrong.
Okay. So how long you see is gaining like a weight like it?
Every week he puts on weight.
Okay. So maybe like a week or 10 days, you see the belly going bigger.
5 to 6 to 7 days he'll put on weight.
Okay. Okay. That's it. Okay. So if you look, the physical exam is also normal, nothing wrong. So what you guys think about this disease? What do you expect in this case? Gaining weight. What's the most common disease you think in your brain? If anybody has any idea, they can text or whatever. If they want to raise your hand, that's okay. That's most welcome. If anyone has any idea, please raise your hand or text. Maybe Miraj or anybody, let me know what they text in the text message. The most common diseases in this case may be the heart disease, congestive heart failure. There's also one of the cause. The belly is filling with the fluid, tumor, maybe mass, anything, parasite, worm, FIP, feline infectious peritonitis disease is very common thing to gaining the weight, abdominal, body has a lot of fluids. Organ failure. These are the most common. There are a lot of other causes, but these are the most important causes why they have belly is distended. What is your next step in this case? Of course, my next step in this case, I will tell the owner we would like to take the X-ray to see what's going on. Okay. When we took the X-ray, you can see this X-ray right now. This more X-ray, you can see this one. If you look this X-ray, you cannot see the organ very well. Let me show you the normal X-ray. If you look this normal X-ray, you can see the liver by here, stomach by here, GI tract by here, kidney by here, bladder by here. But in this case, if you look this one, you cannot see very well. The heart and lungs look completely normal. The heart look very elliptical shape, very normal. But the problem is in the abdominal cavity. There's a lot of fluid in the abdominal cavity. That's why the belly is distended. That's why it's gaining weight. I told the owner, my next step is that we're going to drain the fluid and we're going to send the blood to the lab to find out what's the cause of this, why the belly is filling with the fluid. The owner said, okay, Dr. Rashid, go ahead, do the test. Okay. So we drained the fluid. If you look the color of the fluid, it looked like a milky color, white milky color. I sent the blood and the fluid, everything to the lab. The result is coming back. It's not very interesting. I don't see like any interesting thing in the blood work or even in the cytology. We don't see any interesting thing. In the blood work, I don't see anything. If you look the blood work, all the liver value normal, kidney value is normal. It means liver and kidney working okay according to the blood. The kidney, liver, everything working okay. I don't see like anemic. I don't see the white blood cell high. If it's anemic, then definitely I'm thinking there's something tumor, some mass, something going on. And the infectious disease, flying leukemia, FIV, everything is negative. Flying coronavirus for the FIP is also negative. Toxoplasma is also negative. So when I see all these things, okay, I tell the owner, I'm sorry, we cannot find yet, but you want answer, what's going on in your pet? We need to do the ultrasound to see what's going on inside the belly. The owner say, Dr. Sheet, go ahead, do the ultrasound. When we do the ultrasound, we are surprised. This patient had multiple tumor on the liver. These are the tumor going on the liver. Let me show you more, couple of slides. If I see any, the gallbladder is right by here, but all these shadow is going on the tumor, okay? There are multiple tumor going on the liver. But if you look the blood work is still normal. The blood work does not show the patient has any problem with the liver. You can see this one also with the ultrasound. You can see by here like a couple of, so I get the report from the radiologist. Of course, we send the all the ultrasound image to the radiologist to take a second opinion. The radiologist is also say there are the multiple hepatic masses going on. Okay, so we give the option to the owner. You want to move further? We need to CT scan, MRI to see what's going on with the liver, how far the tumor is that, is it operatable or is not operatable. The owner say no, I'm not going anymore. I just want to make comfortable my pet. That's it. So we make a plan, we drain the fluid like a twice a week, plus we put this medicine, Rutin, and the Samicule is like a liver supplement. The Rutin is a supplement that's available over the counter, is very good medicine to absorb the fluid. You can check online also. I'm gonna bypass this case. I'm gonna discuss like the most interesting case right now. This is the Maggie. This is a case, very interesting case. I think you guys love this case. The Maggie is like a 9-year-old female spade. They coming in our hospital, not doing very well, is still lethargy, not sleeping in the nighttime. The history is that this owner go to his regular vet to find out what's going on my pet. The regular vet do like a test. They did the ultrasound also. And they say they have a spleen nodules or they have some other, they have pain, all these things. And they give the medicine for the pain medicine and that's it. The owner came home 2 days. The patient is not doing very well. Nothing. He's still feeling a lot of pain, not sleeping in the nighttime. Then he go to the ER, emergency hospital, where they have specialized everyone. They check everything, they do like a certain test, and they say this have some neurological problem, some neurological disorder. That's why the patient is feeling pain, a lot of pain. They give the different pain medicine and send home. After 1 day, the owner still feel bad because after 2-3 days, is still not sleeping very well, still not sleeping on the nighttime, lot of pain, animal suffering. He discussed with one of my client, that's his friend. He said, my dog is not sleeping very well. I don't know what's going on. The vet, they did not find what's the reason. He said, why not you try my vet? Is East Windsor Animal Hospital. He's very nice doctor. You can try. Let's see. Maybe he can find out what's the reason. When he came in our hospital, as soon as I take the history, I go in the exam, I check the exam, everything, I tell the right way. This dog has some tick-borne disease going on. Plus, maybe I need to check the blood work to see what's going on. The owner say, how you know that? The first impression owner say, how you know that? I say, let's see the blood work. Let's see the test because I want to do only 2 tests. One is like a tick-borne disease test. Another one, I want to check a CBC cam to see what's going on with the liver, kidney, everything's okay. Why is not sleeping properly? He said, Dr. Sheet, go ahead. When I check the blood work, you will surprise. This patient has positive with the E. canis, is one of the tick-borne disease, and anaplasmosis also. He positive with a 2 tick-borne disease. That's why causing a lot of pain. When I go through the blood, I see all the albumin is high, ALP high, ALT high. What? When I go, the glucose is very high, 407. His blood sugar is very high. The high blood sugar is causing all this problem with the liver. All the liver value high due to the blood sugar is high. That's the reason the animal is not sleeping nighttime because the blood sugar is very high in the body. That's causing all this problem. So when I speak with the owner with the blood work, believe me, let me show you first one. We check like a CBC is okay. We check the urine to make sure that the glucose is coming in the urine. You can see the glucose is also coming in the urine. And other bacteria, rot bacteria mean E. coli is one of the nasty bacteria. Most of the time when the patient had diabetes, the urinary tract infection is very common because the bacteria love in when they have a lot of sugar in the urine. So when I discuss all the blood work, everything, believe me, the owner was crying in the room. He said, I go my regular vet, he did not find what's going on. Then I go the ER, the specialist, they did not find. I feel so bad because my pet is suffering from 10 or 12 days. They did not find what's going on. Okay. I say, listen, we are not say anything wrong what they did, but we are here to treat your patient. We are not do anything. That's not my business to discuss with any other vet, diagnose anything. That's the professional way. Whenever this happen in your practice, please do not backbite. That's not good. That's unethical. The owner was very upset. He so was upset. Then I calmed down. Then I said, this happened. This happened with me also. I can ignore also this thing. Okay. Then he was quiet. Then he was okay. Then we start the treatment. After like 1 or 2 days, he's feeling much, much better. Okay. These are we just want to show the notes. Of course, the drug of choice in the tick-borne disease, doxycycline, plus we send over the insulin and we send other medicine also for the pain. If you look the owner about this case, you will surprise.
That's a story about Maggie. I got Penny, whatever, her son, and I got Leonidas over there. Maggie had issues with, she was crying a couple days in fall. And when I went to my regular vet, and she got diagnosed with nodules on her liver, spleen, and she had a urine infection. And she gave me some antibiotics and a painkiller. And she told me if it gets worse, then just bring her to the hospital. So she's crying day and night. And by Tuesday, something like that, Wednesday, I went to North Vet Hospital in Robbinsville. And after 4 or 5 hours, they told me she had a chronic degenerate nervous system, which I found ridiculous. And they gave me painkillers and they sent me home. And still crying. Then Thursday, my colleague said, why don't you try East Windsor Hospital? He goes, they might help you out. So, I mean, when you don't sleep 24 hours for 10 days, me and her trying to calm her down. I brought her to East Windsor Hospital, and my first impression was I saw a picture of Dr. Rashid with a lion. This is the Lion King doctor, so I think he can take care of her. And it only took him like 5 minutes to tell me she's got Lyme disease, the way she walks, and the way she's acting, she's all in pain. So he did a test blood work. He goes, I'll do a full spectrum of the blood work. And he comes back, he goes, definitely Lyme disease, and she's diabetic. That was a shocker to me, that nobody could pick up that. And he said that this is common.
If you look all the honor, what he said that about this thing, that's the importance of the evidence-based medicine. That's why I like to discuss case with you guys to show you that if you ignore these small things that maybe give you trouble in your practical life, make sure you are very sharp, you know what doing, you know what the clinical sign of the tick-borne disease, you know about all these things. Okay, believe me, whenever I take the history from my vet student and my technician, when they coming out of the room, they discuss with me the history. I discuss with them what is the possible cause in this case, and I tell my student right there, this is the possible, this may be the disease in this patient. When I go in the room, when I discuss with the owner, believe me, when we do the test, the result 99% is coming same, whatever we say verbally. But we need to diagnose, we need evidence. If we have evidence in our hand, then we have a confidence what we are doing. Because if the case is challenged in the court or anything, I have a proof what I'm doing. I diagnose this one. What the treatment? I give the proper treatment. After the proper treatment, if still the patient die, it's not my fault. We're doing whatever the best, whatever in my hand. But something is not my hand also. The next case, I want to show you that sometime the first case, if you see that how we do the step by step to diagnose the disease, this is the very interesting case also. This is a 9-year-old female spale is coming in our hospital. It's the same problem, like abdominal is gaining, but it's not eating very well also. Otherwise, everything look okay. I told the owner we want to take the x-ray to see what's going on with the belly, first thing. When we took the x-ray, if anyone know what's wrong with the x-ray, please let me know. Or they can raise the hand. This is anyone, if you look the x-ray, they can diagnose the problem right there. Even with a blind person, they can see this x-ray, they can diagnose the disease right way. If you look this one, the liver is very sharp, liver is very neat and clean, very good. But there's a big tumor going on the spleen. The tail of the spleen is right by here. The head of the spleen is by here, the tail is by here. It's a big tumor on the tail side I see. So we checked the blood work. I told the owner this has a spleen tumor and we need to check the blood work to see everything. I see the blood work. If you look the blood work, this all anemic. So that's confirmed also the patient has maybe some cancer tumor going on due to the spleen. Okay. If you look, the globulin is also high. That's also indication maybe infection or maybe tumor cancer cell. Total protein is also high. I told the owner we need to take the ultrasound to make sure that it does not spread to the other organ before I remove the spleen. And I see the big tumor on the spleen. There's a couple of ultrasound. And this ultrasound report also, I get the report. Then we make a decision to go for surgery, okay, to remove the spleen. We don't make the right way. We just do the test, blood work to see if the patient can survive under the surgery or something, like if it's more anemic, does it need a blood transfusion or not. So after that, we make a decision for the surgery, not right way. You can see the big tumor on that's my associate doctor. We're using like a latest blood vessel sealer that seal the vessels. It make my life very easy. Within 10-15 minutes, we remove the spleen. The benefit with the blood vessel sealer, with the laser, all this latest technology is comfortable. Look the patient after like a 30-35 minutes, he start walking, running. It does not feel like we did any surgery, anything. Okay. This is the owner. They write down on the Facebook also. So the thing to discuss with you guys, evidence-based medicine is very important in your practical life, because if you know what you are treating, you have more confidence. You can treat your patient more confidence, and the outcome of the patient and the owner is very good, because the owner will be satisfied also what is my vet is treating right now with my patient, and he also know what's going on with his patient also. So I think that will be enough. And if I have a time, let me discuss like only 2-3 minutes. Right now in USA, there's one injection is called like a Librela. Is like osteoarthritis injection. Is very good injection. Is a once a month. It control the pain with the nerve factor to desensitize. Solensia is in the cat injection for the arthritis. Very good injection. We have the pancreatitis injection also. This one, the new one, cytokine injection is for the atopic dermatitis. We also have the parvovirus injection available right now. So if we give this one injection in the morning, if you check the test in the nighttime, the test result is coming back negative. It's so effective. Only one injection. Take care of the parvo, and the puppy will be loud, feeling happy. Next day, feeling completely normal. This is an amazing injection. I have an injection, but it's very expensive. Not everyone can afford this injection. I want to discuss like only one thing about the Librela injection. If you let me go in there. This is like a once a month. I want to share with this video with you guys.
Osteoarthritis, OA, is an incurable, degenerative, and painful disease of the joints that reduces the quality of life of dogs and cats. OA is often initiated by abnormal cartilage breakdown and the release of pro-inflammatory mediators. The degenerative process extends to all affected joint tissues, culminating in pain and joint failure. Pain signals are generated in the joint, transmitted into the spinal cord via the dorsal root ganglion, and then to the brain, where they are perceived. Modulation can take place at many levels, especially in the periphery and spinal cord. OA pain is a complicated process mediated by many factors, including prostaglandins as well as nerve growth factor, NGF, a signaling protein that is produced by injured tissues. The binding of NGF to TrkA pain receptors present on peripheral nerve endings activates the signal and increases overall sensitization to local painful stimuli. After binding, NGF-TrkA complexes are internalized and migrate to the nerve cell body. There, the complexes direct activities that alter the function of the nerve and sensitize it to pain stimuli. This responsiveness may lead to central sensitization, making pain more difficult to manage in your patients. NGF also binds TrkA on inflammatory cells, inducing the release of pro-inflammatory mediators and more NGF, feeding the vicious pain and inflammation cycle. Despite how common OA-associated pain is in dogs and cats, it often remains under-recognized and undertreated. There is a need for a treatment that, by targeting the mechanism more specifically, effectively relieves OA pain while better avoiding unintended effects. Monoclonal antibodies, MABs, are highly specific immune system molecules that can be used therapeutically to target and neutralize molecules involved in disease. Studies have demonstrated that the anti-NGF monoclonal antibody is an effective analgesic for targeted and sustained relief from OA pain. Anti-NGF MABs are individually designed to target NGF in different animal species. Anti-NGF MABs prevent NGF from binding to and activating TrkA receptors, blocking the pain signals. The previously sensitized nerves return to a more normal function, helping pain regulation in the peripheral and central nervous systems. Additionally, anti-NGF indirectly stops inflammatory cells from releasing pro-inflammatory mediators and more NGF itself. This may play an important role in interrupting pain signaling from NGF. Anti-NGF MABs are long-acting biologic therapeutics that are safely broken down like all other proteins. Anti-NGF MABs may offer an exciting new therapy for dogs and cats suffering from the pain of osteoarthritis and may improve their quality of life.
If anyone has any question, concern, please let me know. And I will hand over the mic, Dr. Maraj. Is Dr. Ajay Madan is here? I think he's not here, look like. He's okay. Anyone has any question, concern, please let me know. And then I will go the host again. Namaraj, go ahead.
Okay, sir. Thank you very much, sir. This session was very informative, and thank you very much for sharing your experience with us. Now, Miss Dr. Myra, please continue from this and okay.
Thank you so much, sir. Now I would like to invite Miss Bushra.
Assalamu alaikum. Starting with the holy name of Allah, the most gracious and the most merciful, I am Bushra Aruj, DVM student of 4th semester in University of Veterinary and Animal Sciences. Vet Kitchen Society is a non-profit animal welfare organization committed to improving the lives of animals through free veterinary camps, sterilization programs, awareness drives, and education on responsible pet ownership. Guided by the slogan, "We treat those who can't speak," it works with communities and volunteers to ensure all animals receive the care and respect that they deserve. It is my honor to have our worthy, gracious, and meritorious Professor Dr. Muhammad Yunus Rana, the recipient of prestigious awards including the Tamgai Imtiaz, HSC Best University Teacher Award, and the Distinguished Leadership Award from the University of Minnesota. We are privileged to have his esteemed presence with us today.
I believe the
Miss Bushra?
Rana Saab is not available.
Yes, sir. He is not present in the meeting. So now moving forward, I would like to introduce the Iron Lady of UVAS, Professor Dr. Anila Zamir Durrani, a distinguished academic and clinician currently serving as the Dean of the Faculty of Veterinary Sciences at UVAS, Lahore. A DVM graduate from the University of Agriculture, Faisalabad, with a PhD in veterinary medicine. She has made significant contributions to clinical practice, education, and research. Her leadership of UVAS 24/7 Extension Service reflects her strong commitment to community outreach and applied veterinary care. We are eager to hear from you, Ma'am Anila. Ma'am Anila, kindly share some words with us.
Madam, are you available?
Sir, I am calling her. Let me see if she is available or not this time. This time she's not attending my call as well.
I believe the Professor Dr. Akamanir Saab is here. I think he would like to say something.
Yes, sir.
Can you invite her?
Sir Akram Nir, please, if you're available, then please speak up. Where is he? He was with us, as I saw him previously, half an hour ago.
I think he's not available.
Sir, he left the meeting.
Yeah, I think it look like. Anyone has any question, concern? So before they have any question, please let me know. We can discuss the question and answer. And after that, we can find if the Professor Anila Durrani is available. One of my friend, Dr. Sarish Ali from USA, I think she's also here, look like. So anyone has any question, concern, please go ahead.
Mohammed Hasib, sir, he raised his hand.
Can you open his mic?
Sure, sir. Please unmute yourself, Hasib. Yes, please.
Assalamu alaikum, sir.
Yes.
Sir, the surgery you have done in which you have cut open the spleen, why can't we only remove the tumor? Why the whole spleen is cut out of his body?
Okay, that's very good question, because this tumor has very big, okay, and if we cut like a half spleen, sometimes the bleeding, you cannot stop the bleeding very well in case spleen, because spleen is full of the blood. The best option is that if you see the big tumor, you can remove all the spleen. The dog can live out without spleen. There's no problem. Just like in a human being, they can live without gallbladder. The same thing with the spleen. Nothing will be happen if you remove the spleen. So it's better to remove the whole spleen. Later on, suppose if you are a doctor, you do the surgery, you remove the half of the spleen. And what happens if the spleen bleeding in the body? What are you gonna do? Do you think you did good job? Not at all.
Yes, sir.
So that's my answer.
Thank you, sir.
Can you open the mic, the next one? Maraj.
Sure, sir. Yes, sir, I'm doing this. Please unmute yourself, Sayyid Ali Haider.
Assalamu
Yes,
alaikum,
please.
sir.
Walaikum salam.
Sir, how are you so good at making a suspected diagnosis that is very accurate? What is the secret ingredient behind it?
Can you repeat your question again?
Yes, please
Sir,
speak up.
how accurate in making a suspected diagnosis? What is the secret ingredient behind this?
Okay. Is experience and knowledge. When you have studied, you should know all the disease, major disease, and their clinical signs. If you don't know about all the major disease and clinical sign, it's very difficult to make a diagnose verbally, whatever you're thinking in your brain. Okay. You should know a lot of things. You should have the experience. It will come with the experience. If you are a final year student or you are going the practice, don't worry, you will gain the experience because most of the time the problem is that in our university in Pakistan, the cases is not coming, not too many cases. Okay, the student does not see all the cases. When they go in the practical life, then they will see a lot of cases. Okay, then they're facing a problem. I think that's the little bit like a drawback. Okay, our university maybe they increase the number of cases, and plus they need to engage the student also. They need to uh, the student should be after like a second or third year they need to go clinic. They need to spend more time in the clinic, discuss with the professor. They have a round also. Unfortunately in Pakistan the caseload is very limited. I think that's maybe one of the reasons. For the proper diagnosis, definitely you need experience and you need a knowledge and you know about the sign and symptom of all the major disease. Who's the next one?
Mr. Tahir Ahmed Babar. Yes, please speak up.
Assalamualaikum, sir. Assalamualaikum, sir. I hope you'll be doing great. Sir, I have a question. Basically, we discuss about evidence-based medicine and surgery. So we need to perform multiple diagnostic tests to rule out differential diagnosis and to come upon a single diagnosis. So basically, here in Pakistan, the diagnostic tests are very expensive, and there is exist a you can call a expensive or economical barrier between proper diagnosis. Many pet owners do not go for multiple diagnostic tests. They find it difficult or burdensome. So they go for primitive treatment like antibiotics, multivitamins, steroids, or maybe NSAIDs. So how can we properly overcome this economical burden or something like that? Every pet owner can afford this or can go for proper diagnosis.
So every pet owner cannot afford all this diagnosis in USA also. We have the same issue, same problem here in USA. But your job is to guide the owner properly, that this patient need this test, very important test, not unnecessary test. Suppose you see like vomiting and diarrhea case or all these things, definitely you need to check like at least like X-ray to see if there's no foreign body. If there's a foreign body, whatever you're treating is useless. So at least you guide the owner that's why we are doing the X-ray, because we are suspected maybe patient has like any foreign body, anything. We just want to rule out. That's the reason we are taking X-ray. Okay. If you guide them properly, they will be agree. But if you does not guide them properly, they maybe does not agree. They maybe say, okay, go ahead, whatever your assessment, give me the treatment, give me the injection, antibiotic, whatever. But at least you can write down in your medical notes or everything that we discussed with the owner this and this thing. Owner declined these tests. We offered this test. What happened? Your responsibility is gone. Is anything happened bad? Is not coming on to you because you have all the written proof, everything that I discussed with the owner, all these things. Okay. Is safety for you, is safety for the owner and everything, because in this way you discuss everything. Not every patient in our hospital also okay with all the diagnostic tests, but at least we guide them properly. We keep our record very neat and clean. Always prefer with my student, vet student, everything. They write my all the notes and everything. I tell them, write down each and everything, whatever I discuss in the exam room, each and everything, word by word, write down on the note. So no one has any problem. When anything happen, we have witness, we have everything. So most of the time when I speak in the exam room, they always typing right there, okay? They're typing the notes right there. What we offering, why we offer this test. They write on the reason also, why we offering this test, what we suspected. Because sometimes the case is going to the insurance also. The insurance also, they asking us, why you doing this test? So these are the very basic thing. But most of the time in USA, they are okay with the test. In Pakistan, I know there's a problem going on. But believe me, I see a lot of positive changing right now, especially in the Lahore, maybe big district, in Karachi also. We see a lot of positive changes. A lot of people, they are doing diagnostic tests also. Is anyone else? Anyone else? I see in the chat room one of the guys, I think is in Florida doing like a PhD. Can he raise his hand?
Anybody has any questions? So please ask, or should I then conclude the meeting now?
Yes, go ahead.
Okay. I would like to thank our honorable guest, Dr. Ijaz Rashid, for graciously taking time out of his busy schedule to attend this event. It has truly been a proud and memorable event for us to have your esteemed presence. Thank you all for your presence. Allah Hafiz.
Okay, thank you everyone. Now I want to close the meeting. Thank you everyone. Okay, see you next time. Next time, inshallah, we will do on conference some life-threatening cases. How we handle like life-threatening cases in real practical life. That will be the most interesting conference, inshallah, with the grace of God, if the God gave me the time. And also my friend, Dr. Midan, Ajay Midan, I discussed already. He's one of the best veterinarian in USA. He's a very good guy. He's from India, but we study together at University of Missouri, Columbia, and he has very good knowledge, practical, clinical, everything. Inshallah, he will be also next time in the conference, give you a lecture also on this life-threatening case, some of the life-threatening case. He will
Inshallah.
Okay. Allah Hafiz. And I hope you
Dr.
have a wonderful
Ijaz.
time. Yes.
Dr. Ijaz, Assalamu alaikum.
Walaikum salam, yes.
Sir, I'm Yasir and currently I'm in Florida. So I just want to contact you. If it is possible to discuss here, or we can through an email, or I can get your number. Would it be possible?
Yeah, sure. Yeah, sure. Yeah, sure. You can get my number.
I will get it from my Iqbalian group if you don't mind it, or I may contact Dr. Asad Ali if you allow me.
Dr. Asad Ali from University US.
Yes.
The professor Dr. Asad, I'm right?
Yes.
Okay. Yes, he has my number. He has my
Okay. Okay, sir. I will contact you probably through your primary cell phone number. I tried to take a screenshot of your email, so I have it. So I will try to reach out to you so I can discuss with you some of the things.
Okay. Dr. Sarish Ali, you want to say anything? She's from USA. I think she's here, or maybe she's not. Okay. Can you open this mic, the last one? What's gone wrong?
Yes, sir. I did, sir. Please speak up. Yes, please.
अस्सलाम वालेकुम सर।
Yes.
सर मेरा आपसे एक सवाल है कि जो डीवीएम का स्टूडेंट अभी न्यूली एडमिशन लिया है तो उसे कब प्रैक्टिकल लाइफ में जाना चाहिए, यानी कि उसे कब किसी क्लिनिक पे जाके इंटर्नशिप करनी चाहिए? क्या उसे 9th सेमेस्टर के बाद ही इंटर्नशिप करनी चाहिए या 4th सेमेस्टर या 2nd सेमेस्टर के बाद भी वो इंटर्नशिप कर सकते हैं किसी क्लिनिक पे जाके?
The best thing that in USA, whoever going in the university, they already trained. They already doing in the clinic, in the vet clinic. The university did not accept the admission until they have certain hours working in the hospital. Unfortunately, in Pakistan, this is not a system. Okay, you should, when you take the admission, you should have interest to attend the clinic because the clinic is very important. That's the knowledge you need in the field. Okay, theoretical knowledge, the book knowledge is gone. You it is okay. You need that knowledge also, but in practical life, you need something like hand-on practice. You know that how you handle. You know how to draw the blood. You know how to treat the patient. You need to know all the drugs and all these things, whatever available in Pakistan. It's better when you get the admission. Second year, you can start clinic. You can make a clinic rotation whenever you have a time. Go in the clinic, visit in the clinic if they allow you. I don't know about the policies, anything.
Thank you, sir.
Dr. Ismail, please speak up.
Hello, sir. I'm Dr. Ismail. Can you hear me, sir?
Yes.
Yes, we can.
Yeah. So, sir, I'm working in Saudi Arabia as a associate vet. So I have a very short question. So we have most of the diagnostics here, the chemistry and CBC, X-rays, ultrasound.
Yes.
But the one difficulty I'm facing here, those cats and dogs which come with signs of some toxicity or some sears. So can you guide us? What's the way to diagnose the diseases? What's the pathway to find diseases based on the sears? Because we don't have really tests available here to like CT, MRI related to the brain issues or neurological issues.
Is very difficult. If you don't have a diagnostic tool, then it's very difficult. Then the best is that your observation, your clinical experience, what you want to diagnose. Suppose a dog eat or cat eat any toxin, you need to check the blood work, and you definitely want to see the liver value is high due to the toxin. You definitely have idea the cat or dog eat toxin, and you need what's your next step? What kind of toxin is that, and how you want to prevent this one? And these are all things that depend upon your clinical experience also. Who's the next one?
Okay, sir. Sir, is there any test? Is there any tests available? Like what kind of tests you have there in your practice, which helps to diagnose with these problems?
We have.
So we can request here as well. If they can make them available if possible.
I have I contract with a tool lab, Antic, and the IDEX lab. Plus, I have a University of Minnesota, a University of Missouri diagnostic lab. So I have all the tests available online. Whatever the tests I need, if I need, the owner is okay, we send to that lab also. So all the tests is available. You can name any test. I can tell you we have available that test. Okay.
Okay, sir. Thank you so much, sir.
But if you need like a test, like all the test or something like, is a big book or something like, I don't know. How can I help you in this case?
So we have the basic ones, sir, like electrolytes and the chemistry panel.
Yeah,
we have like 3-4 different types of chemistry panels, dry chemistry.
Yeah, I
So
completely.
we can run these tests, but we can't really make sure it's poisoning or coming from the brain or some other problem.
Okay, I completely understand. I know. Okay, who's the next one? Because I have to. Marai, can you open the next one?
Yes, sir. Sir, I saw the message from Muhammad Umar. He said Dr. Miss Anila joined us. We should make her the co-host so she can conclude or she can leave a message to the students.
Okay. Can she's here? Just give me one second. Yes, let me make a course.
Sure, sir.
I make a course. Okay. You can go ahead, Murad. Madam, you hear me now?
Ma'am, please speak up. Yes,
Thank
ma'am,
you.
please.
Yeah, I can hear you, sir. And I lost my connection for some time, but I really I had a very. Can you hear me now?
Yes, yes.
Am I audible?
Yes, we hear you.
Yes, ma'am.
Yeah, thank you so much, Ijaz. I'm really very grateful again for your time and your efforts that you are doing a lot for the students of veterinary sciences in Pakistan, and students are following your advice. As far as your evidence-based medicine sessions are concerned, they were started by Vet Scare Club, and now Vet Crescent has also taken lead in that with RIFA students as well. So the thing is, the message is spreading, and the message is spreading to other institutions. I am very happy for that we have students from Tandojam also with us. So I just would like to suggest to all the students that make use of all of these sessions. And you people are really very lucky that Ijaz Sab is getting his precious time out of his busy schedule, especially on the off day. And all the questions that are coming in your mind, they are valid, and they do need your. We do need to answer all of them, but due to shortage of time, it may not be possible at this moment. You can send your questions to the question bank, and then maybe if Ijaz Sab has time, he can reply you back later on. But yes, yes, a student from Gomal is also with us. Welcome, beta. And I'm really very happy to have all of you here. Evidence-based medicine is very important for you and for us as well, because we faculty members also learn a lot from these sessions. And in the present scenario where knowledge-based technology or knowledge-based economy is the need of the time, these sessions that give student-centered learning and evidence-based learnings are really very important, and they are helping us a lot. We are heading toward change in the curriculum as well. So when we finalize our curriculum of clinical sciences, especially medicine and surgery, I would request Ijaz Sab to have a look on the curriculum, and then you can suggest changes accordingly, because now you must be very much well aware of the knowledge gaps in the student, and you may be able to suggest us in a very positive way that what the curriculum of DVM needs to be, where it needs to be rectified actually. So we have made a lot of changes in the delivery of these lectures as well, and we are using technology based lectures also in UBAS. But it would be great if all the faculties everywhere in Pakistan, they come and they join us in the delivery of subjects, especially clinical subjects, and in the evidence-based medicine, where you are the focal person for us, and we are happy to have you today as well. I am also really very thankful to all the faculty members who have joined, and to all the students who are here, and they are interested in this series of evidence-based medicine. Thank you so much, sir, once again. And I'm just conveying thanks from Rana Sahab as well to you. He is occupied, but he has conveyed his best wishes to you and a lot of appreciation for all of your efforts. Thank you so much, sir.
Thank you very much. Thank you very much, madam, for your nice word. And inshallah, we will do combine. We can do everything, and with the grace of God. And also, I would like to say, all this conference and whatever we do, like evidence-based medicine, I believe the major role and credit go to Madam Professor Anila Durrani. She is the major resources person. She will discuss with me. And I'm telling you, all the students, you guys are very lucky, especially the US, to have Professor Dr. Anila Durrani. She's very cooperative. Whenever she gave me any message, the message is only for student, not anything else, only for the student. Sir, you can help this student, this one, this one, this one. I think you are most lucky person. You have this kind of sincere person, and God bless you. And thank you, everyone. And I think we want to close the meeting. Thank you. If you have any question, anything, you can text Maraj or Professor Dr. Anila Durrani or anyone. They can convey my all the question, answer I will give you. Okay. Thank you. Allah Hafiz. Allah Hafiz. Anyone want to say anything?
Anybody has any questions?
Yeah, the Muhammad Osman, I think, I don't know this. Maraj, can you open the Muhammad Osman and we can close the meeting, okay?
Yes, sir, I did.
Assalamu alaikum.
Waalaikum.
I am Muhammad Usman from Arid University. I am in third year, sixth semester. I did my first internship in last summer. Junior veterinarians are very suppressed that they think that they have not any kind of their good career in Pakistan in future if they go in pets. So we are not having any kind of guidance from any sorts from teachers. From they said that the big cities are full of veterinarians working in pet side. So we are very unlucky to have information about to move to have experience to move in other countries like UK, Germany. We have information that we have just a lot of money to move in Europe, in other countries. So can you help us with the information and have a good decision to move in other countries for better future, for better career?
Let me tell you one thing, okay? You guys are most lucky. You have a DVM in Pakistan. The DVM to getting the admission in foreign country, in USA, especially in USA, is very difficult. It's very expensive also. The one semester costs you at least like $60,000-$70,000. And you guys are very lucky because I don't know about your university or something like. As far as I know, the US is recognized here in USA. The students who are graduate from the US or any other university, they are recognized with the USA. They can give the exam, they can pass the exam, and they can have a better future also. Plus, the future depends on you, not on the any professional. If you have any professional, always I want to say the future is depend on you. Why I want to say depend on you? It is you who want to make the future. Because if you have a strong clinical skill, strong knowledge, strong everything on the grip on the knowledge, if you go in the field, no matter how many practice they're doing, you will be still very successful. Keep in mind, trust on you and build your clinical skill. Then you will say, oh, I'm fair or I'm successful. Failure is not you remove all these things, negative thing from your brain that we are unlucky or unlucky, we have this profession. You have to maybe think about the God bless. You give the opportunity to treat the innocent animals which cannot speak, which cannot do. But make your career, future with study, with the knowledge, with a clinical skill. If you don't have a clinical skill and you still wanna say, oh, why select the DVM program? I know some people, they don't like to see that animal also. They don't touch the animal also. I think they are wrong professional.
Okay, thank you, sir. It's very lucky for us to have this kind of event. Thank you so much for hosting such an event.
So I want to say, like all the Pakistani student, believe me, they are very lucky. Ask me here, the student who working under my hospital, they struggling to get the admission. In my hospital, each and every year, one of my students, they get the admission. But it's very hard to get the university admission, to be very honest. Very hard, very difficult, very difficult. And you guys are very lucky. You get the admission like it's not like I know that some university, the merit is very high. I know the US merit is very high. I don't know about the other university. There are private universities open right now. Rafa is open right now. I know about the Rafa, what their merit. But as far as I know, US has the highest merit. Am I right or wrong? Maybe ma'am is here also, Professor Neela Durrani. I think after the BDS or maybe the close to the BDS, the merit is close to the in US. I think that she can explain you better than me. I think she knows better. But as far as I know, the student getting very high mark, they can get the admission in the US. Not everyone student. Am I right or wrong? Madam, are you here? Okay, I think we can close the conference and everyone has a blessing day. Thank you very much. And if you have, yes.
Yes, you're right. And we should be very grateful. We should be grateful.
मैडम आपका स्पीकर में प्रॉब्लम है मेरा लगता है. Maraj, can you see the mic?
Yes, sir, I am doing.
Can you see the ma'am still here, ma'am?
So she has an issue with her internet connection. That's why she left again the meeting.
Okay. So I think I believe we almost done the meeting. Anyone has any question, anything?
Yes, sir, we are.
Who's the vet Christian Society? What's the name that
Muhammad Umar Farooq, sir. Muhammad Umar Farooq, sir.
He's here?
Yes, sir, he is.
Can you open his mic?
Let me check, sir.
Sir,
Yes, please speak up, Muhammad Umar.
yes, sir. First of all, sir, Dr. Ijaz Hashi, thank you so much for joining us. And it was our first time by opportunity by Professor Dr. Anila Zamir Durrani and my society, Vaccination Society. And as a president, it was my first event, doctor or as a my professor friend to motivate us by joining veterinary medicine. And thank you so much, sir. And thanks to all people who joined in this event. Thank you so much.
Okay.
Anybody has any questions?
I think,
I guess not, sir. Should we conclude the meeting?
yes.
sir.
Yeah.
Okay. Once again, thank you so much, Dr. Ijaz Rashid. We are truly honored and delighted by your esteemed presence. It was a proud and memorable moment for us. Thank you all for your presence. Allah Hafiz.
Okay, thank you, everyone. Thank you. Let me close the
Thank you very
meeting.
much. Thank you.
Allah Hafiz, sir.
Thank you.
Allah Hafiz.
Thank you, everyone. Okay. Okay. Allah Hafiz. Allah.
Allah Hafiz, sir.